How can I understand my specific arthritis type? Imagine trying to fix a car without knowing what's wrong with it. Understanding your arthritis is similar. You need to identify the specific type to get the right treatment. Arthritis isn't just one disease but over 100 different conditions that affect your joints. Each one has unique causes, symptoms, and patterns. Knowing which one you have is the first step toward managing it effectively. Start by talking openly with your healthcare provider. Share all your symptoms, even the small ones. Describe when your joint pain happens, how long it lasts, and what makes it better or worse. Do your joints feel stiff in the morning? Do they swell or look red? These details help your doctor see patterns that point to certain types of arthritis. Your doctor will examine your joints closely. They'll check how much you can move your joints and look for swelling, warmth, or deformities. Sometimes they'll look at your skin or eyes because some arthritis conditions affect more than just your joints. For example, psoriasis can cause joint pain along with skin patches. Lab tests are often part of the process. Blood tests can find signs of inflammation or autoimmune activity. For example, elevated levels of C-reactive protein or erythrocyte sedimentation rate suggest inflammation. Blood tests can also detect specific antibodies like rheumatoid factor or anticyclic citrullinated peptide, which are linked to rheumatoid arthritis. Uric acid levels in the blood can point to gout. Some tests look for genetic markers like HLA-B27, which is associated with conditions like ankylosing spondylitis. But remember, no single test can give a definite diagnosis. They all work together with your symptoms and exam. Imaging tests help visualize what's happening inside your joints. X-rays can show bone damage, cartilage loss, or joint deformities typical of osteoarthritis. Ultrasound and magnetic resonance imaging give detailed pictures of soft tissues like cartilage, ligaments, and the joint lining. These images can reveal inflammation or damage that isn't visible on X-rays. Sometimes, your doctor might do a computed tomography scan for joints that are hard to see clearly, like in the spine or pelvis. In some cases, your doctor will perform a procedure called arthrocentesis. They'll remove fluid from a swollen joint to check for infection, crystals, or other abnormalities. This is especially helpful if gout or infection is suspected. Different arthritis types tend to affect specific joints in characteristic ways. Rheumatoid arthritis often involves the small joints of the hands and feet on both sides of the body. Osteoarthritis usually affects weight-bearing joints like the knees and hips. Psoriatic arthritis can cause joint pain along with skin patches from psoriasis. Ankylosing spondylitis mainly affects the spine and sacroiliac joints. Gout causes sudden, intense pain in one joint, most often the big toe. All this information, your symptoms, physical exam, lab results, and imaging, helps your doctor narrow down which arthritis you have. Sometimes, the diagnosis becomes clearer over time as your symptoms change or respond to treatment. Once your specific type is identified, your healthcare provider can recommend the best treatment plan. Some types, like rheumatoid arthritis, need medications that suppress your immune system. Others, like osteoarthritis, focus on relieving pain and protecting your joints. Lifestyle changes, physical therapy, or even surgery might be part of your care. Understanding your specific arthritis helps you and your doctor make smarter choices about your health. It also helps you know what to expect and how to handle symptoms. If new symptoms appear or current ones change, keep talking with your doctor. This ongoing conversation is key to managing arthritis well.